come in.
Hi Kingston, my name is Elizabeth Hansberger and I'm a nurse practitioner student and I'm gonna do your abdominal, musculoskeletal, and nervous system assessment today. Okay. I'm gonna wash my hands. If I can have you just lay down for me. Alright, so first I'm just gonna examine your abdomen and your skin. You have a flat contour of your stomach, and if you could just try to relax. I'm just looking to see if I see any pulsations. I can actually see your heart pulsing here. And I'm looking for a Cullen sign, which you don't have, around your umbilicus. And so, like I said, you have a flat contour, symmetric. Your chest and abdomen is symmetric. There are no visible lesions, abnormal pulsations, or peristalsis noted on the visual inspection of the stomach. So now I am going to auscultate for a bruit in the aorta, the renal, and the iliac, and the femoral arteries. Okay? So I'm just listening for like a thrilling sound in those areas, okay? Okay. So this is your aortic area. We're going to move over here to the renal area. The iliac area. And your femoral area. Alright, I did not hear a bruit in any of those areas. So now I'm going to listen to your bowel sounds in all 4 quadrants. I'll need to listen in each quadrant for a full minute, okay? That was 1 minute. 2 minutes. 3 minutes. 4 minutes. Alright, so you have bowel sounds are present in all 4 of your quadrants and they are normoactive. There is no bruit in any of the abdominal arteries. And so now we're going to move forward with percussion. I'm going to percuss in all 4 quadrants, looking for tympany, dullness, or flatness. We're also going to percuss over the liver and the spleen, looking for the size and the margins. Okay? Put this over on my table. So percussion is where I place my hand, and you'll just feel me tapping, okay? Okay. Just trying to make sure you can. All right. And now I'm gonna percuss over your liver and see if I can try to hear where the margins are, okay? So I'm gonna start down here. So I'll call that the first one. right, so we'll call that 3 finger breaths. So there was general tympany heard over the abdominal area, and dullness heard in the upper right quadrant over the liver. The liver borders measuring 3 finger breaths. I'm gonna just percuss just over here, over your spleen. Right. Now we're gonna go into palpating. So first I'm just gonna do some light palpation on your abdomen, and then we're gonna go a little bit deeper. I'm gonna try to palpate your liver and your spleen as well, okay? I'll be looking for any masses or tenderness, or just anything. If I push anywhere and it makes you uncomfortable, let me know, okay? Okay. So let me just push here. Anything making you hurt? Okay. I'm going to go a little deeper, okay? And that doesn't hurt? All right. I'm also going to do something called the scratch test. So I'm just going to place this on your xiphoid process, and I'm going to try to hear a difference in the waves, okay? In the sound waves. Okay. And then we're going to come from up here. No, let me go from this way. Seeing if I can hear the edge of your liver border. Okay. And I think that says about the same, about 3 finger breaths, just like the other one, okay? So your liver is palpable about 2 centimeters below the right coastal margin at the midclavicular line. There was no abdominal tenderness during palpation, and the scratch test shows the same borders as when I percussed the liver, about 3 finger breaths. There was no signs of splenomegaly. Okay, so now we're going to do a couple of different signs, okay, that we can look for. Okay, so I also need to palpate your liver. So first I just want you to breathe in really deeply, okay, and I'm going to try to feel for your liver, okay? Take a deep breath in. Okay, good. And take a deep breath in on this side. Okay, good.
Sweet.
Okay, now we're going to do some stuff that's a little bit more specialized. First, we're going to be looking for the Murphy sign. This is something that can be indicative of cholecystitis. So first, I'm just going to have you breathe all the way out. And then I'm just going to... and then breathe all the way out. Out. Exhale. Now inhale. And that doesn't give you any pain? Okay, good. Now we're going to look for the sow sign. So this, first we're going to just have you lift your leg against my resistance. Do you have any pain here? Okay, and could you turn on your left side? All right. And then try to push your leg back a little bit. Okay, now let me pull back. I'm going to just pull it. You don't have to move. Do you have any pain right here? Okay. Okay, you can lay back on your back now. Now we're gonna do the obturator test. So first I'm just gonna bend your knee, and then I'm just gonna internally rotate it. Do you have any pain? Okay. And now we're gonna test something called the McBurney's point, and I'm just gonna push down on your appendix area, okay? Tell me if you have any radiating pain, okay? Anything? All right, perfect. Now we're gonna get into the musculoskeletal portion. I will need you to take your socks off for this part for some of it, but I know that makes you uncomfortable, but we'll get through it together. If you could just stand up for me so I could just look at the alignment of your joints. Your shoulders are aligned and your elbows are aligned, your arms are aligned. Do you feel like you have any joints that are hot or painful? Okay, and I don't see anything that looks like that. So I don't see any deformities, and you're not reporting any tenderness that you have in your joints. So the joints are aligned. There is no visual deformities. There's no warmth or tenderness noted. And so now I'm going to check your capillary refill in all four extremities, okay? Okay, you can have a seat. Do you want to go ahead and take your socks off now, or do you want to do it after we do your fingers? Okay. All right. All of those are good. Less than 2 seconds. Okay. Would you like me to take them off for you?
Yeah.
Okay. So good, we're fighting through things like immune anxiety. Okay, you ready?
Which is weird. Don't give me anxiety.
Okay. It's good. And this one. Okay. Capillary refill is good, and all of your toes. Here we go. Oh, sorry, I put your sock on the wrong way. Here we go. You're gonna have to fix that for me, sir. All right. And now I'm just gonna palpate all of your pulses, okay? So first we're gonna check your brachial pulse. Okay. And now we're gonna check your radial pulses. And I'm gonna check your posterior. Now I'm gonna check your posterior tibial and your dorsalis pedis. And your posterior tibial. This is your patellar up here. Posterior tibial, dorsalis pedis. All right. All of your pulses are +2 and palpable. Now we are going to move into some range of motion testing. So first we're going to start with your neck. First I'm just going to have you put your chin to your chest to check your flexion. Okay. And then I'm going to have you put your neck to the back to do extension. And then I'm just going to have you go to the lateral on each side. Okay. And then can you rotate your neck for me to each side? And do you have any pain with that? All right. His neck movements are smooth and controlled. He has a full range of motion noted in all directions. And so now we're going to look at your shoulders. We're going to, if you could just cross your arms like this for me. And then open your arms like this for me. And then if you could pull up like all the way up like this. And then come down. And then if you can go like this way. You can stand up if you need to. Okay, and then if you could go like this and internally rotate and push back for me. Okay. And then do circumduction for me in a circular motion. Okay, and you don't feel any issues, no popping or clicking or pain when you do that? Okay, perfect. So his shoulder movements are smooth and controlled. He exhibits a full range of motion and reports no pain or restriction in the movement. So now we're going to do the Apley scratch test. And I want you to be able to try to join your hands together at the back. So like try to reach there and there. All right. That is great. Do you have any discomfort when you do that?
Nope.
Okay. So now we're going to do flexion of your elbow. Both elbows, please.
Like flex them?
Yeah, like flex up like this. And then I'm going to have you extend. And then I want you to do pronation and supination. Okay. Good job. And then we're going to do, we're going to flex our wrist and extend our wrist. And we're going to do like a radial bend. I want you to bend your wrist up this way towards your body. Like this. Yep. Good job. Now down. Hold your arm still for me and just do like this. Great. On the other hand now. And you don't get any pain from doing that? Okay, and then go ahead and do a rotation for me with your wrist. Okay, you don't feel any clicking or popping or anything with that. Okay. Now we're going to do our fingers. If you can make a fist for me. And then if you could open them for me. And if you could adduct them for me and abduct them for me. And you don't have any popping or clicking when you do that. Okay. And then if you could hold your hands out in front of you and just flex your thumb back for me so I can identify your snuff box. See this right here? This right here is the snuff box right here. All right. So the patient exhibits a full range of motion in the elbow, the wrist, and the fingers, and the thumb when identifying the snuff box. Movements are smooth. There are no clicks, pops, or resistance or pain when performing these movements. Okay, so now we're going to do a couple of other tests. If I can have you just sit down for a second. And I'm just going to have you place your wrists out in front of you like this. And I'm just going to tap. Do you feel any pain or radiating tingling? Okay, and can I do the other one, please? Do you feel anything? Okay. That's called the Tenniel test. We're just tapping to see if you're having any pain related to carpal tunnel. So if you could take the backs of your hands now and put them together like this. We're going to actually try to put them more 90 degrees. Okay. And then we're going to actually sit here for a whole minute. And then I want you to tell me if you're having any numbness or tingling. Okay, this is called the Fallon test. All right, it's been a minute now. Do you feel any pain, numbness, or tingling in your hands? All right. So there is no numbness or tingling and no signs of carpal tunnel. Now we are going to do something called the spurling. This is for cervical radicular syndrome. First we are going to do extension of the neck. So first we're going to extend your neck and then I want you to turn laterally and I'm going to put a little bit of pressure on your neck, okay? If you could kind of turn to face that way so I can get to your backside, just like on the sit down. There we go. Okay, so again, if you can extend your neck for me and give me a little bit of a lateral turn. Is that painful? Okay, I'm just going to give you a little compression. Is that painful?
Yeah, a
Little bit? All right. You just need to lighten up on those video games, buddy. Now we are going to look for something called the drop arm. So I'm going to bring your arm up to 90 degrees. I want you to relax it. But when I let go, I want you to be able to control the movement. If you can't, this can tell us that we have like a rotator cuff tear, okay? Are you ready? Okay, good. Now let me check. You can face the front so we can test this other side. Okay. And then can you drop them slowly? All right. Now we are going to elevate your arms to 90 degrees in the scapular plane. And I want you to rotate your palms towards the back. And then can you resist against my pressure? Good job. Does that give you any pain? Okay, perfect. No pain is noted on either of those activities. And so he is not showing signs of a rotator cuff tear via those signs or the cervical radicular syndrome. Now we are going to look at the Hawkins sign for shoulder impingement. So I'm gonna have you lift this arm, and then no, you can put that one down. I'm gonna put my arm right here, and then I'm just gonna internally rotate your arm. How does that hurt? Okay, and then I'm gonna. Does that hurt? Okay. Now we are going to do the Finkelstein test. This is going to test for gamer's thumb. So I'm just going to actually have you kind of hang your wrist here and relax. So first, I'm just going to have you on your own push your wrist down. Does that give you any pain? Okay, now I'm going to actively pull down. Does that give you any pain? Now I'm going to pull your thumb in and down. Does that give you any pain? Okay, and we'll do the same on this side. Yep, first you do it. Great. No pain? Okay. Then I'll do it. And now we'll pull this one down. And you don't have any pain. Okay? Good. And now I'm just going to... You didn't feel any clicking or popping in your arms or your shoulders when we moved them. Okay, good. Now we are going to move on to the deep tendon reflexes. So first I'm gonna check your brachioradial reflex. Okay, we'll test on this side. Okay. Now we're going to test your brachial reflex, your bicep reflex. Okay. Now I'm going to test the bicep tendon on this side. See how it moves your finger? Okay, and now we're going to test your trapeze. Just scoot over just a hair for me so we can remain here in the camera. And if you could just relax for me. Relax. All right. And now we're going to do this side. All right. And if you could sit back enough for me that your legs relax, can you just relax them for me? You ready? Okay. This is your patellar. And then we're gonna check your Achilles. If you'll just let me hold your ankle for you. Okay. Now let me see the other one. Let me just see if we can. Okay. And then if you could have a seat lay back for me, I'm gonna test something called the Babinski. I'm gonna be looking to see if your toes fan out is a abnormal sign. Okay. I'm gonna be running my reflex hammer up the side of your foot towards your big toe. Okay. Okay. Ready? Okay. Now I'm going to be looking for something called a clonus. I'm going to be jolting your foot up and then looking for kind of like a flapping motion, okay? Are you ready? So we'll be pulling up like this and looking at the foot. There's no jolting, which is good. And we'll pull this up. No jolting, which is good. No clonus. All right, so now I'm gonna have you just roll over to your stomach. That way we can just go ahead and get the hip on your stomach. Yeah, first we'll do on your stomach because we have to do your hip extension. And so this one needs to be done on your stomach. So I'm just gonna have you lift your leg towards towards the back. Like lift your leg up. All right, and then drop it. Now lift your other leg. All right, now you can roll over. Do you have any pain when you're doing that? No. Okay. And now we're gonna do flexion. If you could bring your knee to your chest. All right. And then we're gonna do adduction where you lift this leg. I'm gonna hold this leg, and then if you could just cross this leg over your body. Okay, yep. Now I'm gonna lift this leg and then cross that leg over towards me. Okay, good. And then if you could move this leg out to the side. Okay. And then I know we're in a little bit of a compromise for this other leg, but if you could just kind of show me that I can move out to the other side. Great job.